Hi and welcome to this Wound Hygiene Bite-sized podcast. My name's Shelley Hawkins, Strategic Customer Engagement Manager at Convatec. During this bite-sized series, we'll be introducing you to wound hygiene, a simple 4-step protocol of care that anyone can do for hard-to-heal wounds. So for this third episode, we're going to start by going into the solution. We spent the first 2 episodes exploring the challenge that we face and what biofilm is. So today I'm joined by Dale Copson, Clinical Strategy Manager at Convatec. Welcome, Dale. And Dale is also a TVN based in the East Midlands. So, Dale, can you tell us all about cleansing as part of the first step of wound hygiene? Why is it so important?
Thanks, Shelley. When you think about step 1 and cleansing, it's not just about the anointing of the wound with a splash of saline or water and giving it a quick wipe over. Although, if I reflect on my earlier days as a junior TVN, that was acceptable practice at the time. We need to sort of view this now as an actual treatment. And that's why it's referred to as therapeutic cleansing. Okay, so what we're trying to do really is actively remove any surface contaminants from the wound and the surrounding skin. So surface contaminants being things like cellular debris, exudate, devitalized tissue, so loose slough or softened necrosis. Also, any sort of microbial planktonic bacteria that's still on the wound bed. And ideally, we want to do that to sort of prepare the wound for the next steps of the wound hygiene protocol. So it's really, really important.
Okay, great. And how can we make sure that we're cleansing effectively? What tools can we use to make sure that we're doing that really well?
Yeah, all that's required really for effective cleansing is some gauze or a clean cloth, soft wipes, and a suitable cleansing solution. And in the past, we've used to use saline or water to cleanse these wounds. But what we do know is in isolation, saline and water will not effectively remove biofilm. So if you go back to the consensus document, what that suggests is we use surfactants. So surfactants are compounds that will penetrate biofilm, destabilize it, but also prevents any planktonic or free-floating bacteria from reattaching to the wound bed. A good analogy that I tend to use when I'm sort of educating is the greasy frying pan.
Yeah.
So you've got your pan, it's full of grease, and you've got your cloth and you've got some water. And you try to remove that grease. Okay, all you're going to do is smear that grease across the pan.
Yeah, absolutely.
Yeah. So adding a few drops of liquid detergent starts to loosen that grease. And when you clean it further with some more water, you start to lift that grease, and then you've got your nice clean pan. And that's how surfactants work on the wound bed. So they change that surface tension.
Thanks, Dale. That's a really great analogy, and I'm sure one that everyone can relate to.
Also to add, the consensus document doesn't really recommend the use of more cytotoxic solutions such as hydrogen peroxide, chlorhexidine, or povidone iodine solutions. They can potentially damage new tissue and then obviously interfere with the healing process.
Thanks for that, Dale. Just to finish us off for this episode, what tips would you give our listeners to make sure they're cleansing these wounds really effectively?
Yeah, absolutely. I think if you listen to the clinical team at Convatec talking about this step, the mantra that we tend to use is clean it like you mean it. So that is in relation to the wound, really trying to actively remove that devitalized tissue, that excess exudate, slough, and potential exposed loose biofilm. Yeah. When you consider the surrounding skin, obviously, again, we need to think about working 10 to 20 centimeters away from the wound edges. Or if you've got a dressing that's larger than that, the area that dressing or device may sit. We also need to consider cross-contamination and the prevention of that. So if you're using cleansing cloths or wipes, use them for that particular part of the wound only and change them accordingly. So don't go from area to area or limb to limb. And also don't put the soiled cloths back in the cleansing solution. And for legs, particularly a lined bucket that's specific for that patient. Again, all this will help to prevent any cross-contamination. So if we invest the time to thoroughly cleanse the wound and the surrounding skin, it's going to set us up nicely for the next step of wound hygiene.
That's great. Thank you, Dale. Some really great tips there for getting us started with the first step, which is cleanse for wound hygiene. In our next episode, we're going to be talking about debridement, which is the second step in the wound hygiene protocol of care. So please join us for the next episode.
Thanks, Shelley.